Hi everybody, it's Dr. Magnifico from Jared'sville Vet and Probably.com, and this is my dog Jekyll. He's about a 7-year-old beagle. Yesterday, my staff came to me and said that he was having a bout of violent head shaking. As you can see, his ears are pretty red. He was shaking his head nonstop. He just couldn't stop. It was sort of like a head shaking fit. He is a beagle, so because beagles have very long pendulous ears, it's very common for them to get ear infections. This was not an ear infection. When I picked him up, he was very warm to the touch. His skin was really red. His ears were brick red. They were really on fire. He had a mass taken off of his foot not too long ago, and he had a pain patch, and as you can see, his skin is still a little bit red, but that skin right there was really, really red, and he was warm to the touch. So immediately I looked in his ears. That's the first thing you want to have your vet do. I looked in his ears. There wasn't anything in there. And then I gave him an injection of diphenhydramine, which is generic Benadryl. He got that in the muscle. It took about 10 minutes for that to work, but it stopped his head shaking. This morning, he did the same thing again, so I gave him another antihistamine. If your dog goes into a violent fit of head shaking, you have to worry about the ears. You have to worry about oral hematomas happening. So that is a big pocket of fluid that collects in the ear, and it looks like pillows. He's having some sort of allergic reaction. Quite honestly, I am too. It's sort of allergy season now. So we are going to keep him on an antihistamine, but the most important thing to do is to get your dog to the vet immediately so that they can give him an injection of either a steroid and an antihistamine or an antihistamine. I didn't give him a steroid mostly because he's on something for his foot right now, and he didn't want to combine a non-steroidal with a steroid. So he got an injection of diphenhydramine in the muscle, and then today I'm going to have to keep him on something for his allergies, and I'm just going to keep a really close eye on his ears. So his big thing was he was shaking his head really violently, and then his ears were bright, bright red. So please give Jekyll a little hello and tell him that his mom will take good care of him. And if your dog has really violent head shaking, head over to your vet immediately. I expect that you'll have to pay for an exam, which at my clinic is $50. And then I also expect you're going to have to pay for the diphenhydramine injection, which is the best way to get the antihistamine into his system. You can do it orally, but it takes a lot longer, so I prefer to do it in the muscle. And it took about 10 or 15 minutes of me just sort of holding him and petting his ears for that to work. He just got an oral antihistamine, so it's probably going to take about 30 minutes, so that's the difference. And just try to really protect these ears so you're not dealing with oral hematomas after that. I have a blog on oral hematomas. You can Google Krista Magnifico and oral hematomas or ear hematoma, and that will come up, and I'll talk to you about that. If you have any questions, you can reach me anytime at Probably.com or find me at Jared'sville Vet. Say goodbye, Jekyll. We're going to get your ears fixed. Bye.